Karl, it was a big weekend. And there's crime, there's weather, but the border crisis, it continues, and it seems to be picking up speed.
Oh, absolutely. And I think former Congressman Gowdy is absolutely on target. We cannot get this issue resolved until we decide to get it resolved. And border security is critical. I do think he's right. I think there's some people out there who are very happy to have this remain as a political issue. People on both sides, frankly. But you know, this is a terrible problem for our country, and we better get control of it. You know, I'm amazed the Biden administration is talking about getting rid of the Trump administration rule that said, for public health reasons, we're going to immediately turn back into Mexico people that we get from people who are trying to cross the border. And I don't understand why we're trying to do that, why we're trying to reverse this. Is the health crisis gone? Do we have no problems anymore from COVID? You know, when I saw the administration, the Biden administration thinking about doing this, I went and checked the vaccination rates. 46% of all Americans are vaccinated. In Mexico, it's 16%. About a third of what it is in the United States. But think about the countries from which we're seeing these flows come. Guatemala, less than 1% are vaccinated. Honduras, almost 0.5%. Same in El Salvador. Nicaragua doesn't even report how many people are vaccinated. It's so little. And what does that mean? That means that we have people who are more likely to have COVID, who are coming into the United States, who have a much higher prospect of having COVID, and we're going to release them in a vulnerable part of our country where the health systems are already strained and can be easily overwhelmed by people who are sick and need to be taken care of.
The contradiction is stunning. You're talking about Title 42, right, Karl?
Right.
And
Title 42.
The report suggests that by the end of July, they would reverse that decision, which would mean that the folks coming across from Mexico would no longer be turned away. And the reason why Title 42 was put in there is because they were trying to make sure you don't bring a lot of COVID into the country. I mean, it's really backwards.
Yeah, now remember, earlier in this year, we literally had to have these communities along the border had to pay for their own testing because people were coming across the border, being released, and wandering through their downtowns to get to the bus station. And they literally, the bus company said, before we allow anybody on our bus, they need to be tested because people are getting sick. Our staff are getting sick. Other passengers are getting sick. We've got to have a policy that nobody gets on that bus unless they've been tested. And, of course, that put even greater pressure inside places like Brownsville and Harlingen and McAllen. Starr County, where Roma is one of the poorest counties in America. And think about if you release all those people, what kind of demands that are going to be placed immediately on the social services of that county. They need to be fed. They need to have transportation. They need to have health care. And that community is already strained to the limits already with its own normal problems without adding this on top of it.
Karl Rove's keeping an eye on everything for us, and the state's sending law enforcement to the Arizona and Texas border to help Florida, Idaho, and Nebraska. You can imagine there's probably going to be more to come on that. Thank you, Karl.
Nice to see you.
You bet.